Assalamualaikum. My name is Sayyida Sakina Abbas and I'm a member of 12. I would be continuing the part A of this presentation and my group member Sayyid Mohammad Nesam would be continuing the part B of this assignment. So the topic which is assigned to our group is to record the blood pressure of an individual. For that, we would be requiring four things: a human subject, an examination table or a chair, sphygmanometer, and a stethoscope. Sphygmanometer is an instrument which is necessary for measuring the blood pressure, and a stethoscope is placed on your brachial artery on the left arm uh, at the time of measuring the blood pressure. So the basic theory which we would be studying during this topic would be the definition of blood pressure, what is a cardiac output, systolic pressure, diastolic pressure, and a pulse pressure. First of all, what is blood pressure? The pressure which is exerting on the walls of the artery means at the time of pumping of the heart, the pressure which is exerting on the walls of the artery, that pressure is known as the blood pressure. The systolic and the diastolic pressure combinedly is known as blood pressure, and the normal blood pressure of an individual is 120 by 80. Second, cardiac output. What is cardiac output? Cardiac output is the product of the heart rate and the stroke volume. Means how much volume is ejecting out from the heart in one beat. Per beat, how much blood is ejecting out from the heart is known as cardiac output. Uh, Other thing is the systolic pressure. The pressure of the arterial, the pressure of the atria, the contraction pressure is known as systolic pressure, and the relaxed state, when the heart is in a relaxed state, it is known as the diastolic pressure. So the systolic pressure is 120, while the diastolic pressure is 80 millimeter of mercury. Pulse pressure. The pulse pressure is basically the difference between the diastolic and the systolic pressure. Means the pressure, it is 40 millimeter of Hg, that is 120 and 80. The difference between the 120 and 80 would be the 40. So that pressure is known as pulse pressure, and it is basically defined as the difference between the systolic and the diastolic pressure. That is the difference between the contraction pressure and the relaxation pressure of the heart is known as pulse pressure. Next, physiological variations in the blood pressure. We can see that the blood pressure can vary from age, from your physical state, from your mental compatibility, from your uh, etc. So the blood pressure can vary from person to person according to their physical state. Uh, the the age factor is the most important thing. That the blood pressure of a normal healthy human is 120 by 80, but as far as it is concerned with the age, the person with the age of 40, 45 mainly uh, develop the difference in the blood pressure. Other thing is that obese patients can also develop blood pressure, that is called hypertension, very easily. These patients are more common in having the blood pressure issues. Other thing is that diurnal variations. In the early morning, the pressure is slightly low, but gradually increases with the time. Uh, it's like hypertension and its type. Hypertension. What is hypertension? The blood pressure which is not normal, high than its normal ranges, will be termed as hypertension. Hypertension can be of various reasons. It can be caused due to various reasons. It can be due to stress, due to the diabetes, due to any physical state. It can be of various reasons. It is a very common premature death worldwide. Up to 1 into 4 men and 1 into 5 women are the patient of hypertension. There are three major type of hypertension. One is essential hypertension, other is secondary hypertension, and the other is malignant hypertension. Essential hypertension is of no particular cause. It can be developed due to any particular reason. Secondary hypertension is the hypertension which is caused due to any medical condition. For example, if your kidneys are infected, your arteries are infected, you are having some endocrine issues in your body going on, then you might develop some secondary hypertension in your body. For example, if your arteries are blocked due to atherosclerosis, you will be becoming patient of hypertension, that is secondary hypertension. Malignant hypertension is extremely high blood pressure, that is ranging to one 140 by 200 by 140, like 180 by 120. It's real high blood pressure, and that should be treated in a medical emergency situation. What are the complications of the malignant hypertension? The person suffering from malignant hypertension may have severe health issues, aortic dissection, coma, fluids in the lungs, heart attack, heart failure, stroke, sudden kidney failure, because it's a huge complication. Hypertension. Hypertension is concerned with the low blood pressure, that is less than 120 by 80. The person having hypertension may be symptomized as fatigue, dizziness, nausea, clammy skin, depression, loss of consciousness, blurry visions, etc. The references. Thank you so much.